Hello, everybody. We have with us a very special guest, Dr. Saumya Mehta. He is very good with full mouth implants and is passionate about it. So he is today at Oramax, and let's do a small chat with him. Dr. Saumya, welcome to Oramax. How are you
Thank
feeling
you so
today?
much. It's a pleasure to be here.
Okay, so डॉक्टर आप इतना implants डालते हो full mouth implant cases you do and nowadays all many dentists want to
Right.
directly put their hands in implants after passing out, and they are exploring, they're studying, they're doing fellowships in implantology. So what is that pro tip you like to give to all the dentists who is watching this podcast?
Nowadays, lot many dentists. I guess all the dentists want to, place implants,
Correct.
and they just want to start placing implants. They want to
Make
do
money.
good, make money. That is one of the things.
Hmm.
And the thing is, implants. It doesn't fall into a specific subject.
Correct.
It
It's like
doesn't.
everyone can do it.
Yes, everyone can do it. So how
Earlier
to
it was a
start?
monopoly of oral surgeons, prosthodontists and periodontists. आजकल
Right.
तो everyone is doing it.
So I feel it goes hand in hand.
Hmm.
So you should know a little bit of perio, you should know prosto and the oral surgery part of it as well, and also how to handle the complications.
But nowadays people are doing like 1 or 2 days, 3 days workshop of implant, and then they feel they can master implants, they can do implants. How much time it takes to actually learn implants as per you?
It all depends from doctors to doctors. Like if they are passionate enough, if they grasp more information very fast, they do all the things rightly step by step, then they can easily start with their a single case, a double case. They can just start within few months.
Correct.
But then only with time,
Yeah.
only after doing so many cases,
Yes, you become more confident.
yes, you become more confident. Then you jump onto full mouth cases, all on 4, all on 6. Then you jump onto immediate loadings. So it goes step by step. You just cannot jump onto a
Directly.
full mouth case
Correct.
and then come with a failure.
Yeah.
And that's your fault.
Correct. So I would like to tell the dentist out there is, it's like ऐसा नहीं है कि if you are a soldier, you don't just आज भर्ती और कल चक्र भर्ती. There is a whole process involved in that. You need to get a lot of, you have to slog and grind it. It's not easy ki okay you will just start placing implants. Obviously this is called as a dental practice, my dear friends. Dental practice is not like dental masters or dental experts. We are still learning. In fact, I am also learning implants. Implant is a field which is like an ocean, and every day is a new learning day for you. So it's just that you start gradually, steps, start slow, but be consistent. And unless you get into the waters, you will not learn how to swim. Bad roads good roads cannot teach you driving. Unless you have bad roads, you will only become a good driver. Mumbai में गाड़ी सीखना है तो then it's easy. So coming to my next question, since you are talking about failures, there are I'm sure there must be cases of implant failure. They say that if you don't have failures, then you have not done enough.
Right.
So how do you handle implant failures? Especially, how do you convey that to a patient? And if I'm paying say around 35,000 or 40,000 or 50,000 for an implant, and if it fails, there is also a heartbreak होता है थोड़ा. So for both the dentist and the patient. तो उनको कैसे, how do you handle failures?
See, first of all, it is a costly treatment. Okay. For Indian people, it is a costly treatment. Even if they pay 3,000, they want a lifetime guarantee for anything.
Exactly.
They get.
And implant का तो they expect कि अगले जन्म का भी
अगले
guarantee.
जन्म तक चलना चाहिए. So it all starts with consultation. You should convey each and every information to the patient. What all you can expect from the treatment. अगर fail हुआ तो फिर क्या करना पड़ेगा आगे. First step, which is very important in dental implants, to do a proper consultation with the patient.
Correct.
Patient should be well aware that what he or she is going to get, the treatment जो भी है. Once the consultation is done very nicely, patient also expectation little bit it drops down.
Correct.
कि ठीक है मैं लाइफ टाइम का एक्सपेक्टेंसी नहीं रख रहा हूँ, बट काम अच्छा होना चाहिए वैसा.
बिल्कुल बिल्कुल.
Right. So you can say based on the literature, based on last cases you did, कि ये success rate है, these are pros and cons of doing an implant. ऐसा तो नहीं है कि implant fail नहीं होता है.
And ultimately you have to tell them it's a maintenance which is required for them, a long term. Yeah.
And it works hand in hand. How the doctor does the treatment, what is the quality of the implant, how the patient is good with the hygiene. So everything goes hand in hand. How is the
Correct.
lab work? How is the prosthetic, loading you did? Everything goes hand in hand. You cannot blame one single
One
thing,
person, yeah.
but the patient will blame only you
Yeah,
if it
because
fails.
yeah, of course. वो आपके पास आया है, आपको ही ब्लेम
Yes.
करेगा. वो he doesn't know lab में क्या हुआ. He doesn't know what materials are used. He doesn't know the quality of the R&D behind the implants. He knows only Dr. Saumya.
They only know कि हमने इतना पे किया है और ये चलना चाहिए लाइफ टाइम.
बिल्कुल.
That is what, and this is how it works.
Hmm.
If we, think from their aspect also, this is how it works.
Correct.
And they are also not wrong because they are spending this much. They want a good treatment.
Hmm.
So we should try to deliver as, as good as possible.
Correct.
This is what.
And my message here is to the patients who get their implants done is, see, whenever you buy a car, be it a BMW, an Audi or a Mercedes, it comes with a maintenance. It's not like एक बार ले लिया lifetime चलेगा वो car. It's not that. अगर सादा हम गाड़ी, also if you're using it every day, it will not be there for lifetime. It requires regular maintenance, regular going to the showroom, getting it serviced. Even your implants come with maintenance. Don't expect it will be there for lifetime. Implants are not something magical. It's not like जादू की झड़ी. It's like you need to see a dentist every 6 months for your maintenance, for your regular scalings, for your checkups, and it is a lot. So I tell my patients, 50% काम मैंने किया है, 50% is in your hands now. You have to make sure that you do
You
well.
maintain it properly.
Yeah.
Everything needs to be done from their aspect also.
Exactly. If I tell my patients, if I give a guarantee of a particular treatment, first of all, I don't take guarantee. But if I tell them, okay, the warranty, it includes that you come regularly for your checkup. If you come to me after 5 years of doing the surgery, I will not take the warranty because वो 5 साल में क्या हुआ है, I'm not aware.
Regular follow-ups are very important in implants.
Absolutely. So that brings me to the next question is, हमने failures के बारे में बात किया, हमने implants के बारे में बात किया, training के बारे में बात किया. What about how do you get such clients? मतलब implants के patients को आप convince कैसे करते हो? How crucial is the role which consultation plays a role here to convince a patient about a dental implant? There are so many options: bridges, RPDs, dentures, or why should they get implant done? आप क्या बोलते हो उनको?
See, first of all, you should tell patients कि क्या best option उनके लिए है. So now it depends on the money factor. Few of the patients, they cannot afford dental implants.
Correct.
But definitely it is a good treatment option as compared to a dental bridge. We all know that.
Absolutely.
बट पेशेंट को समझना बहुत ज़्यादा इंपॉर्टेंट है. ऐसा नहीं है कि ठीक है अच्छा रिज दिखा, सिंगल इम्प्लांट तो इम्प्लांट करवा ही लो, कैसे भी कहीं से भी अरेंज करके करवा लो. दैट इज नॉट हाउ यू शुड डू. एंड पेशेंट्स को इफ यू गिव ऑप्शंस, देन दे विल थिंक कि नहीं, डॉक्टर ने कुछ फोर्स नहीं किया है करने के लिए.
बिल्कुल.
एंड उनको अगर प्रोज एंड कॉन्स दोनों के भी पता है, दे विल गो फॉर इम्प्लांट. वो थोड़ा रुक के कराएंगे बट कराएंगे जरूर, और आपसे ही कराएंगे. बट आप अगर उनको बोलोगे नहीं ब्रिज तो मत कराओ, आप यही करवाओ, यही चीज़ है आपको करना, यही है.
So basically put the ball in their court.
Yes.
Explaining them about the pros and cons and educating them. I think education is very important.
Very important.
Patients have half knowledge. आजकल most of the patients come to me seeing some Instagram reel or seeing like many dentists do that. 3 days में you get fixed teeth.
Yeah, right.
And they see all those reels and then they come to us and with a high expectation. Okay, doctor, I will get fixed teeth in 3 days. Why are you waiting for 3 months? So it's very, very important to educate the patient about what implant you're doing. So it's all about a mindset. We have to bust their myths. Most implants come with a lot of baggage and myths around in their head, right? So okay, I think that was a good takeaway, that good consultation, it starts with a good consultation. Good consultation means you have to spend quality time with the patient in terms of answering all their questions, your doubts. And then if you're doing a big treatment, you should at least spend 1 hour for a consultation with them. If you're doing a full mouth case, don't expect that patients will come here and they will immediately give you 5 lakhs, 6 lakhs, ki doctor, you do my full mouth implants. It requires some efforts. You need to build a pavement. You have to build the foundation, convince, do a mental transplant to them about this procedure, and then only you get that full mouth implant case, right?
Also, I would like to interrupt and talk about how confident you should be with the consultation. Only if you know how to place an implant perfectly, if you know the knowledge ke, okay, if I'm going to do this might happen, and I know how to treat it.
Correct.
Then only you would be confident with the consultation, and the patient knows everything.
Absolutely.
Once they go out of your consultation room, they know how confident you are, what kind of work you do, what type of ethics you follow. Even if you get one case like that जिसके अंदर you are not confident enough, they won't refer other patients to you. If you do a good job, they will bring another 4 5 patients for you. That is how
Absolutely.
it works.
100%. I agree to that.
Okay, so doctor, I have a question for you. How do you manage your social media influence? How do you make videos? How do you plan on educating the patient, because you do a lot of surgeries and everything? How
Correct.
do you spare some time making content, because it is a new thing and all the doctors, I guess, need to start with content creation and
Absolutely.
educate people.
One very relevant question. I would say that gone are the days where हम जब डॉक्टर के पास जाते थे तो हमको पता भी नहीं होता था डॉक्टर कौन है. हम लोग जस्ट उसका डिग्री देखते थे और जाते थे. वी डोंट डू एनी मच रिसर्च ऑन
True.
गूगल. वी डोंट चेक द इंस्टाग्राम. तभी तो इंस्टाग्राम था भी नहीं. आई एम टॉकिंग अबाउट 10 15 years back. But now, most of my patients, when they come to my clinic, they go to my website, they go to my Google business page, they go to my social media, then they do a entire कुंडली निकाल के आते हैं हमारे पास कि ओके डॉक्टर ने ये किया है. Then they come and then they have that trust. So I feel that today's generation, the youth especially, and the Gen Z, they are well aware, they are well informed, they have a lot of skills, and they are very tech savvy. So you should be there out there. You should be on all the platforms. You can't say कि नहीं I will do my surgery very well. I don't care about social media. मैं word of mouth से game चलाऊंगा. But ऐसा नहीं है. I feel the entire game is today of content creation. And you should, I mean, influence तब होता है आदमी जब when you make a good content creator. Unless you are a good content creator, you cannot be an influencer.
Right.
So when you put out a good content there where you can, and what kind of a content? Like I was at the dental spotlight, Dr. Manan Vora spoke a very good point
Very,
about
very good
content.
point. Yeah.
He's like, your content should be relevant. Is it entertaining? Is it relevant? Is it creating some kind of emotion?
Emotion.
Only then you put their content out there, So, and I would suggest to all my fellow dentists, don't be silly when you put your content out there. Don't tell them, ki, okay, come to me, I will do implant, I'm the best. Dental implant is the only option. You educate them about the pros and cons of the treatment. You educate about the options available, and then let them decide. Put the ball in their court. Unless they develop that trust factor. So you have to give a value-based content to them, not just promoting your clinic or promoting your brand. So that is what it really matters. And I'm also trying and learning and implementing whatever I have learned from my seniors. And I feel it plays a major role, and not just social media, but also Google. Nowadays, Google is the most widely searched thing, for any kind of a doctor. You Google them, you check their reviews, what kind of reviews you have, what kind of website you have. Is it an SEO compatible website? So all of this plays a major role in your practice. And gone are the days where you just get referral patients. Referral patients आपको दिन में कितने आएंगे? 2 or 3 referrals आएंगे. But most of your patients should come from Google, from Meta. You have to run ad campaigns. You have to get out the content there, and that's how you increase, and that's how you scale and grow.
More question, doctor. Uh, what do you feel about bad mouthing in our field? Like, I have seen many dentists bad mouth एक दूसरे का बोलते रहते हैं.
बिल्कुल, yeah,
Not directly, but indirectly they will tell to patients something like that.
Correct,
कि ये डॉक्टर ने अच्छा काम नहीं किया है.
Yeah.
इसने ऐसा किया है, इसने वैसा किया है.
I think everybody must have faced this in their practice, and I feel, see, I'm a strong believer of karma.
Right.
What goes around comes around. If you do bad mouthing about another dentist, it will definitely come back to you. It's a boomerang effect. So don't think that you are escaping or you're getting one client. You might get one client, but you will lose 10 more, right? Karma is a bitch. And another thing is, see, अगर किसी dentist से गलती हुई है, we are all practitioners.
Right.
Nobody is expert here. We are humans. To err is human. You will make mistakes. What is a mistake and what is negligence? Suppose if I'm doing an RCT and I know that if I put a file there, it is going to break. If I know that, but I'm still putting a file there, and if it breaks, that is a negligence. But if I know that, okay, if I put a file here, it will break, I'm not very confident, I'll rather call a consultant. So that is, and if it gets broken by mistake, that's called as a mistake, right? So it's a thin line between a mistake and a negligence. If you are doing a mistake, it's okay. You will learn from your mistakes, right? Same is in implant dentistry. You don't be overconfident कि okay, I can manage this case. You should know your limits. Okay, I will not do this. I should not put my hand there. I'll rather call a senior consultant who will be there to help me out, who will do the case, unless ruining the case or spoiling the case. So I feel bad mouthing is only those people who are very shallow minded, they will do it, and who are envious of others. But even in my practice, I have experienced this, but I feel that even if the job is not done properly, there are ways to say it to a patient.
There are
You don't
ways
have
to
to say,
convey it, yeah.
ways to communicate it, right? You can be a more gentler way. You can't say, "Arey, ye kya kar diya hai?
Ah,
What is this? What kind of a shabby work is?" You can always say that this can be better.
that's
There is
it.
always
Yeah,
scope for improvement, right? There is good, there is better, and then there is best. You can't always expect कि best काम ही आपके पास आएगा, नहीं तो आपके पास patient ही क्यों आएगा, first
very
of all.
true.
So you should always scope for improvement. That's how you have to convey to the patient कि I can do the same work but in a better way. I can make it a little better because I have this thing. The dentist has also done a good job, but I can make it a little better. That's how you communicate. So then that is called as non-violent communication.
Even I feel you should never put, you know, any of the dentist's name, you know, down.
Absolutely.
Yeah.
Yes.
Because we don't know कि वो डॉक्टर ने क्या फेस किया है वो टाइम पे, वो
बिल्कुल.
डॉक्टर कौन से स्टेज पे है. Maybe he or she is growing.
Yes, absolutely.
Maybe that is a failure
And we
for
have all
him
gone
to-
through that phase,
Yeah,
right?
right.
We are not कि हम लोग starting से ही experts बन गए. We have also made mistakes. We have also gone through that phase. We should support each other, right? That's all the dental community is all about. You should not like, you know, that game is there when if people pop out and you have to hammer से उनको नीचे धकेलना है. We are doing that. Whoever tries to go up, we are just smashing them down back. So हमको वो नहीं करना है. We have to encourage each other, and that is what I learned about dental spotlight. People are collaborating, they are mixing, meeting each other, and we have to grow as a community. They grow rather than compete with each other. You have to grow together, collaborate. I always believe in these three words: connect, collaborate, and create. Unless we collaborate, we cannot create. One person cannot do
That
so
is that.
much. It's a team effort, and I think the small community of dentistry, unless they come together, they join hands, they value each other, only then they will take dentistry to another level in future.
And if like-minded people come together, it is a complete
It
different
can
game.
create a miracle, it can create wonders. Dr. Saumya, I am a big fan of your documentation. I love your work, what you put it on the social media. And I wanted to ask this question for all my fellow dentists out there. Many people don't document their cases. They do a lot of cases. I am one. I'm guilty of it, you know. That मैं करता बहुत cases हूँ, but sometimes you're so engrossed in a surgery, you don't document it. You just feel कि okay, my hands are in blood. How will I take a camera? And you know हमारे assistants तो इतने expert होते ही है photography में. So हम लोग कैसे करें? How do you document?
Okay, so I feel documentation is very, very, very important. You know, documentation will, you know, solve two purposes. One is it will build your confidence. Second is patient education.
Correct.
Both of these things are very important. Documenting a case, for me, it has become very easy now. Initially, it was little bit difficult.
What other tips? How do you do that?
You start with normal, you know, documentation using your phone. You train your assistants how to hold the retractors. You know, air blow करना है mirror के ऊपर, all those things. If they are also confident in holding the retractors and everything, it would be very easy for you to document the case.
Correct.
So I document all my implant surgeries, whether it be a single implant or a full mouth immediate loading, whatever it is, I like to document my case.
Okay.
Then I'll just go through it after a day or two, you know, and then just see यहाँ पे ये better हो सकता था.
Yes, it's good for self improvement.
Yes,
Yeah.
self improvement हो सकता था. Even if it fails, document it.
Correct.
You should know कि कहाँ fail हुआ है.
Exactly. So you don't repeat the mistake
Yes,
again.
right. And you know, the more number of cases you do, you will become confident, and then you should have a flashback कि ये केस मैंने ये तब किया था और तभी मेरे से ये गलती हुआ था.
Correct.
Now improve कर सकता हूँ मैं उसके ऊपर. So I
बिल्कुल.
feel documentation is very important, and every dentist should document all the cases.
Even if it's a small case.
Small case also you document it.
And guys, you don't have to buy an expensive DSLR camera to document. You start with your mobile photography. All phones, people have such good phones, good cameras. Just you need good lighting, you need good teamwork, you need good assistance to retract, to keep the job visible. Access अच्छा होना चाहिए, visibility अच्छा होना चाहिए. Then your cases are wonderful. And just a little bit of editing in making, you know, things all right. So basic skills, not something pro level. Just you can all start documenting, and I will take that tip from you from today. Thank you. So thank you, Dr. Saumya, for coming here, giving your valuable inputs, insights on implantology, on dentistry, on documentation, about failures, about, you know, pulling each other down. So good lessons, life lessons, and especially we have learned here. So some closing words to our viewers. What is your take-home message from this part? What did you learn, and what value would you like to add to people who are watching this?
Okay, so thank you so much, sir. It was nice meeting you as well. So for the dentists who are out there who are just starting new everything, just find your passion. You cannot focus on all the aspects. At एक point के बाद you need to select a field and become a master of that field. Okay, so just find that. किसी किसी को वो बहुत जल्दी समझ में नहीं आता है, किसी किसी को लेटर स्टेज के बाद समझ में आता है, किसी किसी को तो ये भी समझ में आता है कि अभी बस डेंटिस्ट्री मेरे लिए है ही नहीं. So it is not bad to you know
Realize that.
pursue other thing also. You should be passionate about what you are doing.
Basically, you should have your niche. You should know what is your
Yes.
one man army नहीं बनना है. अपने को selectively एक ही जगह पे specialized करना है. Dentistry is vast, so you should know what to pick. You know.
बिकॉज काफ़ी लोग देर आर डॉक्टर्स जो MBBS से BDS में आए हैं, BDS से क्लिनिकल नॉन क्लिनिकल फील्ड में स्कैटर हो चुके हैं बहुत ज़्यादा ही. बट इट्स नॉट दैट कि बस अगर नहीं पसंद है तो फिर वो
Correct,
करना
correct.
ही है वैसा टाइप का. सो
Absolutely.
फाइंड योर पैशन, फोकस ऑन दैट एंड बी अ मास्टर ऑफ दैट फील्ड, और एटलीस्ट ट्राई टू बी मास्टर ऑफ दैट फील्ड इफ नॉट.
Jack of all trades, master of none. ये नहीं करना है हमको. एक ही select करो, उसको निहारो, and I'm sure people will take this tip seriously for you. So all the best, viewers, and thank you, Dr.
Best
Saumya,
of
once
luck.
again.
Thank you so much.